we're going to continue talking a little bit now about some very specific aspects of healing that relate to dealing with a freeze response, and then we're going to talk a little bit about dealing with protective involuntary muscle spasm. So, let's say you were in a car accident and you're sitting in your car and you realize that that the car behind you isn't going to stop. You're looking in your rearview mirror, so your eyes are looking up into the rearview mirror, and you see that whatever it is that's coming your way isn't going to stop. So you're looking up there, you got your hands on the wheel maybe, and it's like you're glued to the rearview mirror, but the rest of you is trying to get out of the car and run off to the sidewalk. So, and then you have an impact. So that, in some people, will stimulate a freeze response where they've become overwhelmed by the threat. Even if it's a minor fender bender, you can have this happen, and certainly it's more likely to happen in a more serious situation than a minor fender bender. So one of the things I've sometimes seen in my clients in a situation like this is I've got my little Play-Doh vertebrae here, and it would be as if, let's say, these top two bones, and we're looking at the front of them, I gave them little eyeballs, so as if each of the bones could be looking one way or another. Well, if the head's looking up and to the right, then typically you're going to have some up and right with the first couple of bones in the neck. Let's see if I can get that to happen. All right, so they're looking up and into the rearview mirror. But the rest of you, these lower levels, they'd be like going over this way. So you can have some of your neck doing plan A and some of your neck doing plan B, and then the whole system gets shut down in a freeze response, and you can stretch your neck and you can do all sorts of different activities, but the underlying pattern now in your neck is a couple of bones up and over to the right and the lower bones down and over to the left. And until you help that underlying pattern resolve, it's going to tend to stick around, because the freeze response is a very powerful rearranging of how the body is going to operate. There's a Gary Larson cartoon, which I have loved for many years, and it's the one where the top half is what we say to dogs, and the bottom half is what dogs hear. So the top half is the guy's looking at his dog, and he's pointing at her sternly, and he's telling her, "Ginger, that's it, I've had it. You stay out of the garbage." And the bottom half is what Ginger hears, and the dog hears, "Blah, blah, blah, Ginger, blah, 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 Ginger." And so if you've got a freeze response going on in your neck, let's say, you can tell it to relax, but as far as your body's concerned, that's blah, 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 Ginger. It doesn't get it. So we have to have some way to help settle the body down and help it get over what happened. And the normal mechanism for that is through the animal kingdom also. So we'll put on the safari hat for that. Right. So in the wild, when an animal has been threatened, goes into a freeze response, and then has an opportunity to recover from that, like when a gazelle gets taken down by a cheetah, then parked up in a tree while mama cat goes to get the babies so they can have their dinner, the gazelle has a chance to get away. So it needs to come out of the freeze response. It has to pay attention to the environment around it, has to recognize that the threat is not immediately there, and it'll tremble and shake and have changes in breathing and respiration, and it'll enable it to come out of this highly activated arousal in the nervous system, get back to much more like regular, ordinary experience, and get out of the tree and run off, so that the cheetah has to catch somebody else. Okay, now for people, we have a harder time doing that, and we have a harder time releasing and getting over something, especially if we have a pattern in our nervous systems to go into a freeze response and stay there. And that can come from a variety of experiences in life. So In rehabilitation, when a freeze response is being addressed, normal smooth movement has to be reestablished through the area that wants to hang up in the place of freeze. So for the neck, sometimes what I wind up doing with people, in addition to global processing of head movement, neck movement, and processing the threat itself, and sometimes that part is taken care of, and still there's some holding going on in the muscles. Then maybe we might work with the muscles and the bones in a more individual way, segment by segment, and help finish up that processing about where is the bone tending to go, and allowing it to explore that area and then come back again. So it's not a matter of pushing it over or stretching it more like a chiropractic or a manual therapy stretch quality. It's a processing quality that gets reestablished through all the segments. Over time, with a healing injury, and sometimes you have the injury plus a freeze response, and you've got to kind of work them all those aspects apart, you can be left with muscles that just can't quite fine-tune the way they could beforehand, and you need to reestablish detailed, fine control so that the area can become comfortable again. And I'm going to show you with my arm some of the things that I'm talking about a little bit, because my arm was holding my car door a few years ago while somebody drove into it. And I had a major freeze response. I had a head injury. I was hit hard enough to have a concussion, even though my head never got tossed around. And my arm was just terribly sprained. And now here 2 years later, you shouldn't still have a sprain. So now at this point, I've got a movement processing distortion that I'm working on getting back all the way to perfect. So let me rearrange the camera. This arm moves free and easily. I don't have any problems with it. And this arm looks pretty similar to the other arm. It's not quite, this is a little bit difficult, but I have chronic ache and tension in here, and it won't stretch out. So I have a protective involuntary muscle spasm, and I still have some remnants of that freeze response, which are difficult to get to completely go away. The position that I was in, about to get out of my car door that was parked, and my hand was right there. And I know exactly where my hand was because there's still such an embedded glitch in my system. It's like having a deep scratch in your old vinyl record, you know, right there. So here's this tool that I'm using that restores your ability to fine-tune and oscillate. You know, so it's a strengthening thing, and it's this blade, and I can take it and move it all around on my right arm and keep the wobble going without any trouble. On this arm, it's considerably harder. It's much less coordinated. So I've lost that fine-tuning here. But what's interesting is, so right at the very place, over here on my right arm, I don't have that place, I can easily go like this, and you can see the top, you know, is oscillating. On the left arm, if I go into the place where that freeze happened, man, I can hardly get this thing going. That's that quality of stuckness in the muscles. Now if I go over here, it's a little easier, and I try to work my way through that, but man, there is some major holding still right in that place. And that's that disturbance in the nervous system that still needs to be worked out. So hopefully I've given you some more insights into what could be going on with your body as you work towards recovery. In another upcoming talk, I'm going to talk about regional movement sequences and how that's an important component to restore in the body to regain fluid, easy motion and comfort, so that the muscle spasm will go away and you'll feel those qualities of strength and flexibility that you've been missing. Thank you.